I remember what it was like to first get that diagnosis with my oldest. And this is my first baby, and just that crushing reality of like, this is supposed to be my perfect little brand new baby, and he's not perfect. No baby's perfect, but in our minds, we want them to be perfect. And going through at least for me, a relatively brief period of mourning before realizing like, this is on me. Like I can't just lay here in bed and cry. Like I have this baby who's crying that needs to be fed and changed, and I have to take care of him, and I need to figure out what I can do to provide him with the best life possible. And then just going through years and years of hard work and making those decisions that are hard to make as parents, but we make them, and they turn out and they survive, and now I'm on the other side where, I have a high schooler and a middle schooler, and they're mainstream. Their speech is great. We made some great decisions. We made some that weren't great, but it all works out in the end. And they're just normal kids with normal like teenager issues. And to be able to be a part of this community and to talk to those parents who are at that point that I was years ago, or somewhere along that path, and to be able to give them that sense of hope that, there's kind of a light at the end of the tunnel. We'll always be parents. Like we never not get to be parents, and you're always going to have issues, and you're going to be dealing with those things with your children. But it gets easier. You're not making those heart-wrenching, difficult decisions all the time. And just to provide that support. Regardless of the choices that they're going to make for their children, to help them to realize that you're making good choices. And if you're making choices, if you're there, if you're present for your children, and you just love them, like that's what they need more than anything.